Dear Professor, it was very nice to meet, to be acquainted with you and to get your valuable consultation about my dyslipidemia in Istanbul 2 months ago. After taking fenofibrat per dosage 145 milligram per day, my triglycerides, the level of my triglycerides decreased about 5 times. And the level total cholesterol decreased about twice. My question, how long time I must take fenofibrat for?
Well, unless there is a major change in lifestyle or other risk factors, usually the metabolism of the patient remains the same, and the therapy needs to be continued for a long time. The guidelines are recommending that once the patient is on stable therapy, unless you add on another medication or something else is changed, there is no need to monitor them unless you're thinking of a side effect more than once a year. So once the dose is established, and if there are no side effects like muscle pain or anything else, the blood levels should be measured every year and should be adjusted accordingly. But probably it will be the same throughout life, unless there is a major change in the metabolism. Yes, please, question.
My name is Dion from the Netherlands. There is an increased risk for muscle pain and rhabdomyolysis in the combination of fibrates and statins. How do you deal with that? You just give it, and when the patient gets pain, do you wait longer, or do you change your statin, or what do you do?
In the field study, which was a study of 10,000 patients, the number of patients with myopathy of any significance was actually very low. And there's a very low risk of myositis with a combination of fenofibrate and statins. Gemfibrozil is different, as you probably know, and I think you have to be very careful about that. In fact, some people would say not to give gemfibrozil or with a statin. I don't monitor CK in my patients who I use double therapy on unless they complain of symptoms. And in that case, you'd obviously stop the fibrate first because the evidence is with the statin.